Hi, I'm Gavin, and I just wanted to follow up with you about the stretches that you had a chance to take a look at and how those work. The first thing I always recommend for people who have back pain is to consult a physician, because it's always important to do that, because there are sometimes other issues that require medical attention that are contributing to the back pain. Some of those might be bowel and bladder dysfunction that are associated with the back pain, and another big red flag that's important for a physician to know about is back pain that comes on in the middle of the night without any other provocation, or if you don't have back pain during the day, but it just gets you right in the middle of the night, not necessarily with rolling or moving in bed, but it wakes you out of a dead sleep. That's another important one to consult a physician about. So those two things are important to do. The stretches that you had a chance to take a look at, those address inflammation in the low back, and that's primarily what causes low back pain. Inflammation with regard to some injury that's there, or some ligaments or a disc that's a problem that's inflamed. And those stretches help milk out some of that inflammation around the disc and the back and help loosen things up and reduce the pain. Now when we talk about discs in the back and what those are the spacers between the vertebra in your low back. And if you can see over here, they sit between the two vertebrae, and they're closely associated with some nerves that come out right there at the low back and run down your legs, primarily the sciatic nerve. Those discs can become inflamed due to an injury, or just sometimes mechanical problems in the low back can make those painful and sore. And you can see how close they are to the nerves and how that starts to affect the muscles and can send pain down one or the other legs, can tighten muscles up. That is the other thing that the stretches help address, is those muscular tightness and that muscular stiffness. One of the other primary things that are important for permanently resolving back pain is to get the muscles in the low back that control those vertebrae to work better. A lot of times the muscles in the low back, as you can see here, you've got deep muscles and some more superficial muscles that help control the vertebra and how they move. And conditioning those muscles are very important to resolving low back pain permanently. There's specific stretches and exercises that we'll be going through in some later videos that address those muscles and help firm those up and control the low back so that you don't have recurring back pain. That's regarding the mechanics in the low back, and those are part of your core musculature. So when people talk about core muscles in regard to resolving back pain, that's what they're speaking of, in addition to some abdominal muscles that are also important. So when people talk about ball exercises, which we'll go through in a later episode, and some core strengthening exercises, and even Pilates, if you've heard of that, those three modalities there are important for resolving low back pain by strengthening those muscles that are in the low back along with the abdominals. So we'll take a look at one of the primary core muscles that's important for firming up to begin with, and that's called the Transversus Abdominus.
The transversus abdominis is a deep abdominal muscle that pulls your stomach in when you contract it. Now, this is an important muscle for resolving lower back pain because it helps stabilize the lumbar vertebra. It starts in the front of the abdomen and it wraps around your torso and connects to a large tendon in your low back called the lumbar fascia. When this muscle is working properly, it pulls tight on that lumbar fascia and helps stabilize the lower back when you move and reach and run and walk. When the low back is stable, it is much less likely to get irritated and sore. Now there's a simple exercise to help condition this muscle, and all you have to do is pull your stomach in as far as you can, hold it for 10 seconds, and then relax. And you repeat that 10 times. And this exercise can be done numerous times throughout the day.
So I hope you can see how important that transversus abdominis muscle is in resolving low back pain, and why it's important to keep it in good condition and strengthen it. In the next video, we'll be going over some more exercises that address other key muscles with regard to back pain, and I will see you then. Thank you very much.